Hi, I'm Mark Spindel, age 61. 1 year ago, I had my robotic prostatectomy at New York Presbyterian Weill Cornell Medical Center.
So, how are you doing?
I'm doing fine, thank you. Doing fine.
Usually takes about this much of a time when you move past, move on. I mean, there's so many other things to do.
The first year is the critical time during the recovery of men with prostate cancer surgery. This is the time when they go through initial pain and aches and recovery from the surgical incisions. Then they learn to control the urinary issues. And then finally, sexual function starts responding.
Tell me, how are the erections at this point?
I've taken myself off Viagra. After the 6th month of using Viagra, I was able to get an erection hard enough for intercourse. The most difficult aspect that I had was to recover my sexual functions, which are practically all there at this time.
I think Mark's story is pretty standard for most patients undergoing robotic prostatectomy. There are some who take longer time for recovery of sexual and the urinary function, and there are some who can get it earlier. But most men take right about the time, that's about 6 months, for them to be okay from a sexual standpoint.
It was a period of a lot of anxiety because I was unsure whether or not I would regain my sexual capabilities. And as I said, it took 6 months, but there was reassurance from the medical staff at Weill Cornell Medical Center, as well as reassurance from my wife that it would come back, and obviously it did.
Sexual recovery usually takes longer than what men anticipate. Mr. Spindel was very patient, very much in resolve with what to expect, and that may be one of the reasons why he has done so well.
How are you doing with urine control?
I have absolutely no problem with urine control.
Okay.
Fortunately, after the 2nd day, I was not incontinent whatsoever. I was taken off the diaper as well as the pad.
Mark's story is unique in regards that he did not have urinary incontinence for a long time, maybe a couple of days, weeks. But I must tell, patients do need some time for urinary function to recover. They can take anywhere between 6 weeks, 3 months, or 6 months for the urinary control to be perfect.
So we've gotten your PSA. We'll get the results tomorrow. Your last PSA was terrific. It was non-detectable.
One of the most important endpoint is that the Mark's PSA is undetectable. We have to continue monitoring this on an yearly basis for a long time. Mark is doing very well in that regard.
I've returned to my normal life, and the biggest fears that I had were the 3 fears that everybody has, I think, when they discover they have prostate cancer. And that is, will they be able to remove everything? Will you be incontinent? And will you get your sexual function back? At this point, I feel comfortable and confident that they have taken everything out. They will not find anything. I've gained my continence back, and my sexual function has come back. So I'm back on par to where I should be, and I'm very grateful and very satisfied.
I think Mark's journey from now onwards is going to be basically watching out for PSA, making sure he eats right, making sure he does his frequent medical checkups, making sure he takes care of other issues like colonoscopies and cholesterol, and of course, exercise. I don't anticipate anything major happening from a surgical standpoint at this point, but he has to continue physician visits for the PSA and the rectal exam for next several decades.
Then the 20th year will be a special one.
Thank you very much for everything you've done.